Okay, let's begin to discuss the disorders of the endocrine system. We have seen the normal functioning of all the hormones of the endocrine system. Now we are going to look at what are the disorders. So when do we have endocrine disorders? Either the hormones that are secreted will be excess or they might be deficient. And just giving you an overview, when can they be excess? Generally when there is any tumor, adenoma, because they are glands, so the tumor that arises from the gland is called as adenoma. So either there is an adenoma in the gland, or there is constant stimulation to release the hormones. That can also lead to increased levels of the hormones, right? Now that can be the type of disorder, or the disorder can be when there is no hormone secretion. So no hormone secretion can be either because the cells are not functioning properly, or there is an excess of inhibitory stimulation, or inhibition on the, sorry, not stimulation but inhibition on the gland, right? So this is just a general overview. So all the disorders of the endocrine system, something is going wrong. Either there is an excess stimulation, or there is a tumor, or there is no negative feedback. Something is going wrong somewhere, because of which this is happening, right? The first endocrine disorder we are going to discuss is hyperthyroidism. Hyperthyroidism means when the thyroid gland is functioning in excess. So the thyroid hormones thyroxine, T3, T4 are getting secreted in excess. That leads to a condition known as hyperthyroidism. What can be it is also called as thyrotoxicosis. That is their toxic condition of the thyroid gland. So that leads to an increased circulation of the thyroid hormones to the peripheral tissues. If you remember, we talked about thyroid hormones. They are like kind of the most important metabolic hormone. They can regulate all the functions of the body, like they can also regulate the heart and the nervous system, and they also regulate the metabolism of the muscles and adipocytes and everything, right? So if there is an increased circulation of thyroid hormones, imagine how much damage it can do in the body, right? Now what are the causes that can lead to an increased thyroid condition, thyroid hormones? Either it can be tumor. Remember we talked about adenoma. Either it can be an adenoma, or it can be due to some medications, or it can be due to goiter. Goiter is again accumulation of iodine that leads to hyperthyroidism, right? A tumor of the thyroid gland. And Graves disease. Now every gland can have an autoimmune dysfunction. Remember the autoimmune diseases that we discussed, where antibodies are formed which are against the normal cells of the body, right? They are called as autoimmune. So the normal cells of the body are attacked by the antibodies which are produced inside our body only. So that autoimmune disease which leads to hyperthyroid condition is called as Graves disease. Okay, and most common cause where there is a raised level of T3 T4 in the body is Graves disease, the autoimmune condition. Now what happens in hyperthyroidism? What will the patient have, the affected individual have? There will be protruding eyeballs. Why will there be protruding eyeballs? Because there is an increased tissue mass around the eyes, so there will be a decreased blinking of the eyes and a decreased eye movements. Okay, the thyrotoxic crisis can be there. What is thyrotoxic crisis? Is there will be hyperthermia. Remember, thyroxine also regulates the body temperature, so there will be hyperthermia, tachycardia, heart failure, delirium, because increased thyroid hormones are in the circulation. So as we discussed earlier, they affect the nervous system, they affect the body temperature, the heart, and everything can go haywire. Okay, how can you treat the hyperthyroid condition? You can treat by giving a radioactive iodine. I'm sorry for the spelling mistakes. So radioactive iodine, surgical removal of the gland, or use of antithyroid drugs. So depending on what stage of the disease you are, accordingly the treatment is given. Either you can give antithyroid drugs, those are like propylthiouracil, methylmethil, all these kind of antithyroid drugs which are prescribed. PTU, and there is also something with a C. I can give you the names, but we don't need to go into so much details. The common ones are PTU, propylthiouracil, and methimazole, something like that. Okay, There can also be a surgical removal of the gland. You can just remove the gland because there might be a tumor or something, or they can also give radioactive iodine. So radioactive iodine will go inside the thyroid gland and will destroy the follicles. As the follicles are destroyed, the hormone level production will be decreased, right? But after all these treatments, there is always a risk of hypothyroidism in these conditions. Okay, so whenever a hypothyroid case is getting treated, the physician has to take care that the thyroid hormone, the hypothyroid person might go into hypothyroid condition because of the treatment. Okay, just a diagrammatic image. I know when we discussed this hypothyroidism in the class, the same image was used. It is a good image. It gives a very clear idea, and it will also keep you in your memory, hopefully, that you see a guy who is fanning himself because he feels sweaty or hot, because he has an intolerance to heat. The fine and straight hair, there is bulging eyeballs, you can see over here. There is facial flushing, thyroid is enlarged, the heart is tachycardic, there is increased BP, there is weight loss. You see the pant is, he has clipped the pant because there is weight loss. There can be breast enlargement, there can be muscle wasting, there can be edema. In females, there can be menstrual changes, there can be diarrhea, because remember it also affects the GI secretions. There can be tremors and finger clubbing also. Okay, just an image to show exophthalmos. How does it happen? These are the eye muscles around the eyelid, the fat tissue, optic nerve, and see over here how the eye muscles swell, and because then they can become stiff because of the excessive thyroid hormones. Because of that, the eyeball which is supposed to come inside cannot come inside, and it stays outside. See, it's getting pushed forward. So even the eyes cannot close properly, and there is less blinking and drying of eyes, and all kinds of complications start happening. That was about hyperthyroidism. Now coming to hypothyroidism. So when the thyroid hormone levels are decreased, what can be the causes? Now causes, again there is one autoimmune cause that is called as Hashimoto's thyroiditis, where the thyroid glands are destroyed. There can be iodine deficiency, which can lead to a hypothyroid condition. It can also occur as a result of the treatment of the hyperthyroidism we just discussed in the previous slide. The anti-thyroid drugs can cause hypothyroidism also. There is a condition called as myxedema, which happens in the adults, and that is called as hypothyroidism in the adult, that is called as myxedema. And when there is hypothyroidism in the children, it is called as cretinism, that is congenital hypothyroidism. And it is generally seen in the cases when the mother is hypothyroid during her pregnancy. Okay, so iodine deficiency during the pregnancy can cause cretinism. Also, what happens in most of the cases is during the pregnancy, if the mother is hyperthyroid, she is on drugs, right? But because in pregnancy it cannot be maintained properly, more or less she stays in hypothyroid condition. Because of that, the baby can also have a hypothyroidism, that is called as cretinism. And remember how thyroid hormones are helping with the brain. So there will be many side effects in cretinism, like brain is not properly developed and symptoms like that. Okay, so signs and symptoms: children will have mental retardation, adults will generally have cold intolerance, hair loss, and menstrual irregularities. Treatment: very simple. Thyroid hormone is less, replace the dose of the thyroid hormone, right? And another image to help us remember what is how an hypothyroidism affects. You can see, remember, try and remember this guy. He's wearing earmuffs and scarves and everything. His intolerance to cold, that's why he's wearing all this stuff. There is a receding hairline, you can see. He's getting bald. Facial and eyelid edema is there. There is no exophthalmos, right? There is only edema on the face and around the eyes and everything. The eyes are not popping out here. There is a dull blank expression. There is a lot of fatigue. The tongue becomes thick and the slow speech. because thyroxine is less. He may have anorexia, the nails and hair might be brittle. If it is a female, she might have menstrual disturbances. There can hair loss, apathy. There can be apathy means not getting affected by anything around. There can be lethargy, tiredness, dry skin, which is skin becomes coarse and scaly. The person also has aches, muscle aches and weaknesses all around, and constipation is also seen. Okay, so basically whatever was happening in hyperthyroidism, flip it around for hypothyroidism. Late manifestations can be subnormal temperature, bradycardia, weight gain, decreased loss of consciousness, and thickened skin and a cardiac complications. Okay, decreased level of consciousness. So that was about the thyroid hormones. Now we are going to go to the parathyroid hormones. What are the conditions where there are less parathyroid hormones? So parathyroid, hypoparathyroidism. The cause can be either there is lack of the 4 parathyroid gland. Remember the 4 dots on the thyroid gland, they can be lacking, or because of the surgery. Generally when they are doing thyroidectomy, there is a chance that the parathyroid glands also come out with the thyroid because they are in the thyroid gland, right? So when they are doing thyroidectomy, parathyroid glands have also come out. So the following surgery, or if the patient has undergone a radiation of the neck, either due to any tumor, then tumor affecting the thyroid or tumor affecting the the squamous cell carcinoma of the mouth or anything, they need to have a radiation of the neck, and on the side effect of that is condition called as hypoparathyroidism. What are the signs and symptoms? Remember, what does parathyroid gland do? It releases PTH hormone. What does PTH hormone do? It increases the serum calcium level. Now if PTH is not there, the serum calcium levels will not increase. So what will happen? Because of calcium deficiency, it can be hypocalcemic state, which can affect the nerve and muscle function. Remember, calcium is an important ion for the conduction of impulses. Because of that, there will be weak cardiac muscle contraction also, because calcium levels are decreased. So cardiac muscles contract with the help of calcium ions, so that contraction will also not happen. There will be an increased excitability of nerves, spontaneous contraction of the skeletal muscle, leading to muscle twitching and spasms, which is called as tetany. So what happens in neuromuscular conduction of impulses is calcium helps the nerves to relax. Okay, nerve sends an impulse and then it should relax till the muscle carries out the contraction. But because calciums are not there, the nerve keeps on sending impulses constantly. Because of that, the muscle keeps on contracting constantly. Because of that, the person will have twitching and spasms, and that condition is called as tetany. Okay, how can you treat? Give calcium. Calcium is deficient, right? So give calcium and vitamin D, because calcium is not alone, so vitamin D. So that was hypoparathyroidism. Now coming to hyperparathyroidism, where there is a lot of calcium. Okay, remember now what did PTH do? We talked. PTH in excess is not good because it increases the calcium. Okay, increases the calcium, fine, but how does it increase the calcium? By mobilizing it from the bones. So what does it do to the bone? Make them brittle, make them porotic, right? So what can be the cause of hyperparathyroidism? There can be a adenoma, a tumor, or a hyperplasia. It can be due to secondary to renal failure. So kidney keeps the phosphate and it lowers the calcium in the serum. Because of that, the negative feedback increases the PTH release. So what happens in a renal failure, in a kidney failure, is it will keep on kidney will keep on keeping the phosphate, and the calcium will keep on getting excreted. Because the calcium will keep on getting excreted, the calcium levels will be very less. Because the calcium levels will be very less, the parathyroid hormone will keep on getting feedback. Because of the feedback, the PTH will keep on getting released. The parathyroid hormones will keep on getting released. So that can lead to a condition called as hyperparathyroidism. Okay, what are the signs and symptoms? We know that PTH keeps the calcium in the body, so hypercalcemia. Because of the excessive calcium, again, calcium helps with the cardiac and neuromuscular, right? So there can be more calcium is also not good. It will cause the cardiac muscle to contract with more force because there are so many ions to bind. The muscle will keep on contracting with more force. PTH causes calcium to leave bone. We discussed this, right? So that will cause a weakening of bone, osteoporotic condition. There will be also, because there is so much calcium moving around in the body, the risk of kidney stones, calcium phosphate, calcium triple phosphate, all these stones getting formed in the kidney increases. Okay, so stone formation, porosis, all this is not good. That is hyperparathyroidism. What can you do for the treatment? If required, parathyroidectomy. That's the only treatment. Otherwise, how are you going to remove the calcium? You cannot just remove the calcium from the serum like that, right? So you can do a parathyroidectomy. And generally that is what is done, because generally it has increased due to an adenoma. Okay, that's what most common cause of hyperparathyroidism. So that was about the parathyroid hormone gland. Now we are going to the pituitary gland. So hyperpituitarism, what do I mean by hyperpituitarism? Means the pituitary gland is releasing its hormones in excess. What is the treatment if the pituitary is releasing hormones in an excess? I know I'm going in a wrong way. I should first tell you about the conditions, but I think the slide has gone upside down. So let's discuss about the treatment. The hyperpituitarism treatment is generally surgery and radiation therapy. That's what you can do. You can either do a brain surgery and remove the pituitary gland, or you can do a radiation treatment. And causes generally which cause increased pituitary gland hormones are adenomas, small tumors in the pituitary gland. Depending which cells are proliferating, effects are seen. Most commonly, why hyperpituitarism arises is because of a tumor. Now, tumor, which gland cells of the pituitary are increasing, accordingly that hormone will be more. So for example, if somatotrophs are increasing in the adenoma, then the growth hormone will be excess, because somatotrophs release growth hormones. I know I have not talked about all these somatotrophs and gonadotrophs and all those cells of the pituitary. There is a reason, because we don't want to go into those trophic details. Okay, so I'm just giving an example over here, that if the somatotroph, that is one type of cell of the pituitary gland, are increased, then that definite hormone, that is in this case growth hormone, is increased. Okay, now what happens when there is an excessive growth hormone? If it happens in adults, it's called as gigantism. It leads to a condition called as gigantism. If there is a less growth hormone, the condition is called as dwarfism. And in adulthood, when there is a lot of growth hormone secretion, that is called as acromegaly. Okay, what happens is bones are broader, enlarged hands and feet, there will be a thick skull, the mandible or jaw will be protruding, the tongue will be large, and the glucose metabolism may be affected, leading to condition called as diabetes insipidus. Okay, but we're not going into that detail. I can tell you one thing though. How do you identify an acromegaly patient? Is they generally come with the complaint that the wedding ring or the ring what that they have been wearing for so many years does not fit them anymore. Okay, it becomes tight, and they have changed the size of the ring almost 2 to 3 times. Okay, it has increased so much. So earlier they get it changed thinking they are gaining weight, but when they have to get the ring size changed, like for the third and fourth time, they are definitely going to come to you that something is wrong. That means you have to look for this growth hormone. That is how generally those patients present. Okay, another thing might be that some patients might also present with difficulty sleeping, because the tongue has become so large that they have apneic sleep, like disturbed sleep, because the tongue keeps on falling on their respiratory tract, causing them to wake up. So that is large tongue. That is also one of the way they can come to the clinic. Okay, now another hormone of the pituitary, that was about growth hormone. If the other cells proliferate, there can be an excess of ADH, antidiuretic hormone, right? So the condition associated with excessive antidiuretic hormone secretion is called as SIADH, that is syndrome of inappropriate antidiuretic hormone secretion. What exactly happens in SIADH is there is a retention of fluid. There can be severe hyponatremia and which leads to mental confusion and irritability. Remember, when we are doing the general path, I told you sodium affects the brain and potassium affects the heart. So here, as you can see, there is a lot of fluid. There is a condition which is called as hyponatremia, which can lead to mental confusion and irritability. What is the treatment of this condition, SIADH? The treatment is diuretics and sodium supplements. Because the sodium is less, you give them sodium tablets, and because there is a lot of fluid getting retained, you give them diuretics to remove the fluid from the body, right? Diuretics are the drugs which cause urination, right? So you give them diuretics and sodium supplements to increase the sodium. That was about hyperpituitarism. Now we are coming to hypopituitarism. So what happens in hypopituitarism is there can be a cause that the untreated pituitary adenoma, because the tumor was there and it was not treated, it kept on giving signals, finally that it stopped working overall. So that is panhypopituitarism. What will be the patient's condition? Dwarfism, because there is less growth hormone, and diabetes insipidus, because there is a decreased ADH secretion. So what is that? In decreased ADH secretion, the diabetes insipidus, the patient presents with the same complaints: polyuria, polydipsia, severe dehydration, but the treatment here is the replacement therapy for ADH. Okay, diabetes insipidus, I am not going into much detail, but we have to just, you should know what are the two syndromes. If we are talking about SIADH, that is excess ADH, and diabetes insipidus is deficient ADH. Okay, same complaints, but the patient has a severe dehydration here, and because there is less ADH, so a lot of fluid is going out of the body. Okay, so that because of that there will be polyuria also. Because there is lot of urination, the patient will feel thirsty also a lot, so polydipsia also. Okay, the only way you can treat the patient is by giving them ADH. Now we are coming to Cushing's syndrome, where you can see that there is an excess amount of glucocorticoids. And I have all of a sudden jumped from pituitary to adrenal. But Cushing syndrome is because of glucocorticoids of the adrenal gland. What are the glucocorticoids names? Cortisol or hydrocortisone. What can be the cause? Again, tumor, adrenal tumor or pituitary tumor, because pituitary is the one which is controlling the release, right? It releases CRH, and which causes ACTH, which further affects the adrenals. So adrenal tumor, pituitary tumor. It can also be a paraneoplastic syndrome or Cushing's disease, and there can be also iatrogenic conditions. Now I know why I included Cushing's after pituitary is because most of the times Cushing syndrome is associated with pituitary adenoma. Okay, that's why I included here. Now treatment will depend on the underlying cause. If it is because of the adrenal adenoma, remove the adrenal adenoma. If it is because of the pituitary adenoma, remove the pituitary. If it is because of the paraneoplastic syndrome, that means what happens over here is there is a cancer somewhere in the body which is causing a disbalance of all the hormones, which is affecting the pituitary. Because of that, it is leading to a condition called as Cushing syndrome. Okay, so you have to look for what is the carcinoma which is causing the paraneoplastic syndrome. Generally there is a small cell tumor in the lung or any tumor in an organ which is not identified. Okay, it takes some time to find it. It can be also iatrogenic, okay, the condition not known, and depending on, you try to look what is the condition and treat it. This is just an image to tell you how does the Cushing syndrome patient, what are the complaints of the Cushing syndrome. So the patient will have a fat at the back of the neck. You remember cortisol, it will call lipolysis here all the fat getting accumulated over here, causing a buffalo hump. There will be wasting of the muscles in the limbs here and here. The skin will be so fragile and so stretched that red marks and easy bruising it can bruise easily, because the glucocorticoids, the cortisol, is not letting the skin develop properly. The catabolic hormones of the effects of the hormone cause decreased protein synthesis, because we discussed, remember, cortisol effects. There is a delayed wound healing. Because of the delayed wound healing, there can be, it affects the immune system also, so you can see that also. There can be a retention of sodium and water causing edema. There can be also because of the delayed wound healing, there can be suppression of the immune system, which can lead to repeated infections in the person. And you can see over here, the skin is very thin, there is extra fat, cheeks are red, acne can develop, hair becomes thin, the face becomes moon like round, there will be easy bruising, there will be weight gain, pendulous abdomen, and swelling. Okay, because of the Cushing syndrome, the patient will typically present like this. Main complaints that we see in the patient will be a round face and the bruising. Okay, the next disorder that we are going to discuss is Addison's disease. So what happens in Addison's disease is there will be a deficiency of all the hormones of the adrenal gland. Okay, the glucocorticoids, the mineralocorticoids, the androgens, all the three layers, all of the cortex, everything has stopped functioning and all the hormones have stopped secreting. So the disease is called as Addison's disease. What can be the cause? Autoimmune. Something has gone wrong and it is destroying the gland, and it is affecting all the zones of the gland. So that is an autoimmune reaction. The gland can be destroyed by hemorrhage with meningococcal infection, or by viral, tubercular, or histoplasmatic infection also. Okay, either it is seen that sometimes when a patient is affected by meningococcus or by some viral or tubercular or histoplasmatic infection, the side effect of that infection can lead to a destruction of the adrenal cortex, and that can lead to the Addison disease. Okay, now what are the signs and symptoms of the Addison's disease? Signs and symptoms will be decreased blood glucose, poor stress response. You understand, right? Because cortisol, which was released by the adrenal gland, is not getting released, so poor stress response, fatigue, weight loss, frequent infections, hypotension because low sodium concentration, because ADH is not working, decreased blood volume, aldosterone is not working, high potassium, cardiac arrhythmia and failure. There will be decreased body hair, there will be hyperpigmentation, because the everything that is managed by the adrenal gland is not getting managed. Decreased body hair because the steroidal hormones, the androgens, the estrogen, progesterone are not getting released. Okay, now treatment can be either you replace therapy with the necessary hormone or increase the dose at the time of stress. Okay, if the patient is undergoing, person, affected individual is undergoing stress, you might need to increase the hormone levels. Next condition we are discussing is pheochromocytoma. It is a benign tumor of the adrenal medulla, the middle portion. Okay, those were conditions of the cortex. Now we are discussing a condition of the medulla, the middle portion. The signs and symptoms can be hypertension. What are the hormones of the medulla? Epinephrine, norepinephrine. Remember, fight or flight hormones. They can do vasoconstriction, vasodilation, bronchodilation. So if those hormones increase, what can happen? Hypertension, headache, palpitation, sweating, intermittent or constant anxiety related to the elevated blood pressure. Okay, I can tell you why there is hypertension and headache. Remember, because it used to cause the vasoconstriction overall. The norepinephrine caused a vasoconstriction overall. That means the blood vessels got constricted, so the heart had to work more to pump blood. Because the heart has to pump more, the tension in the vessel increases, causing hypertension. Because there is a lot of blood supply going towards the brain, headache. Because the heart has to work more, palpitation. Also the heart is working more, and all the other blood supply from the other organs is getting less, sweating. And there is a anxiety, because constant anxiety, because remember, constant epinephrine norepinephrine levels will be there in the circulation, so the patient will be constantly in a fight or flight mode, so that is leading to constant anxiety. How can you treat? By removing the tumor. Now we are coming to pancreas. Diabetes mellitus type 1. It is also called as insulin dependent diabetes type mellitus type 1 or juvenile diabetes. So what happens? Basic pathology in type 1 is there is no insulin. Okay, why it is called insulin dependent? Because insulin is not getting produced at all, and you start the treatment in this patient is directly by giving insulin. You cannot give drugs or anything to them, and it's a very difficult life for them, because honestly, to take insulin after every meal and they have to be careful every time, it's a very difficult condition. It occurs in children and adolescent. That's the latest it can occur. No adults can develop diabetes mellitus type 1. If you have diabetic symptoms in adult, that means it is type 2. Okay, so when you're getting a case and if the age of the patient is around 5 or 6 and you think that's a diabetes, look if it is diabetes type 1, it will be type 1 only. Okay, and if the age is around 45 50, it's going to be type 2, right? Cause can be a genetic factor. Insulin deficient because of destruction of pancreatic beta cells in an autoimmune reaction, and there is an absolute deficiency of insulin. Okay, as I said, it's a genetic factor. Treatment is insulin replacement based on the metabolic activity and dietary requirements. Now, depending on how much work the patient can do and how much the individual eats, accordingly the insulin is given to the affected individual. The complications are the same as those of diabetes. Hypoglycemia, or the individual can also have cerebrovascular stroke or myocardial ischemia, peripheral vascular disease, amputation, kidney failure, and blindness. These are all the complications of diabetes which are also seen associated with type 2. We'll see them. Okay. Talking about diabetes mellitus type 2, it's called a non-insulin dependent. So type 2 or maturity onset. Okay. So what do I mean by that is, there is not a total deficiency of insulin here. Insulin is getting produced, but either it is not getting produced in enough quantity, or it is not acting where it is supposed to act. Okay, the receptors have decreased, something has gone wrong. Okay, there is a decreased effectiveness of insulin or relative deficit of insulin. Cause can be decreased pancreatic beta cell production of insulin, the pancreas is not producing properly, or there can be an increased resistance by the body cells to insulin. You are eating so much of sugar and there is so much of fat cells that the body cells are like, no, there's too much work, we cannot work, so the body cells are showing resistance. Increased production of glucose by the liver, or the liver is by any chance making more glucose. What will be the signs and symptoms? The signs and symptoms will be hyperglycemia, of course, more sugar level, glucose-urea, so glucose is excreted in urine, polyuria, increased number of times urination, polydipsia, increased thirst, polyphagia, increased hunger, eats a lot, weight gain, because they eat a lot they are going to gain weight, fatigue or lethargy, in spite of eating properly, in spite of drinking so much, they are still tired and fatigued. Type, that is shorter DM type 2. Okay, what are the diagnostic tests? You can do a fasting blood glucose, that's the confirmatory one. With fasting blood glucose, if it comes raised, there is a 90% chance that the individual is having diabetes mellitus. Also, it can be done as a glucose tolerance test, where they give like around some 30 gram of glucose, then they check the blood glucose. First they do fasting blood glucose, then they give a definite amount of if I'm not wrong, around 30 or 300 gram of um, glucose. After that they start measuring blood glucose every hourly, and it has to follow a definite graph, and it should come down at some definite point. So that is glucose tolerance test. HbA1c is a glycosylated hemoglobin which gives you a rough idea of how much glucose level has been there, measuring the hemoglobin A1c type in the RBC. So glucose stays in the RBC in the hemoglobin in the form of A1c. Okay, and the RBC stays into the blood circulation for 120 days. Okay, RBCs die after 120 days, right? So for 120 days the RBC is carrying the glucose. So whenever you measure HbA1c, you can know that okay, this much hemoglobin A1c is present. That means this is the percentage of glucose that was carried by the RBCs, red blood cells, and the definite level is 7%. Okay, the HbA1c should always come less than 7. If it is more than 7, that means that the patient has had high glucose levels for a significant longer period of time. What is the treatment? Generally, type 2 treatment, they try to manage the patient as much as they can with before starting the drugs. So what they will give is diet, maintain the optimum body weight, control of blood glucose levels, exercise, increase the uptake of glucose by the muscles. They can also give oral medications like metformin, which reduces the insulin resistance, glyburide, which stimulates the beta cells to release insulin. That's just the two most commonly used. Otherwise there are plenty of drugs for diabetes. I am not going into the detail. We just need to know the name of the common one, that is metformin. Okay, insulin replacement can be done by giving in injections which uh, are supposed to be taken subcutaneously. The types can be of the insulin can be rapid onset, short acting, intermediate acting, slow onset, and long acting. That are all the different types of insulin. So what they do is generally in the morning they give an insulin which is short and long acting mixed, so that a short acting insulin can act when you eating the breakfast, and long acting will maintain the glucose level throughout the lunch. And there is a second dose scheduled in the evening which is generally of a long acting, which will maintain your rest of the glucose levels from night till the next day morning. Okay, that is how generally the regimens are being done. Okay. What are the complications of diabetes mellitus? There are acute and chronic complications. The most common acute complication we know is hypoglycemia. Because of excess glucose, because people are most commonly, they know that if they eat a lot of sweet they are going to have more glucose, but because of that they do not eat enough glucose and they can land up into a hypoglycemic condition. So that can be precipitated by the excess of insulin, because they have not eaten food properly, and the insulin that they took in the treatment is going to act, so it can lead to hypoglycemic condition. And usually hypoglycemia is seen in type 1, because usually insulin is the treatment in type 1, right? Cause can be a dosage error also, of course. There can be, because it's like 1 unit, 2 unit, 3 unit, you have to be very careful how much you are given. So there can be a dosage error. There can be vomiting. Patient has eaten but they had vomiting, so there was not enough food. Or it can be exercise. Patient ate and also decided to do a lot of exercise, which they generally don't do. So that can also use up the glucose, right? There can be a lack of glucose which affects the nerves, which leads to poor concentration and a slurred speech. Because as soon as the glucose level drop, it affects the nervous system, the brain, and that can cause all these symptoms. Hypoglycemic, the sympathetic nervous system is stimulated, pulse becomes increases pale. The pulse becomes pale, the skin becomes moist, and the patient can have anxiety and tremors. Okay, I think it's a fairly common side. It has happened to us also. Whenever we are in stress, the glucose levels go down, and so we start sweating, and the skin becomes moist, and we become anxious, and there are tremors in the hand starts trembling, and the first thing we think about is let us eat something sugary, right? So because we know that that is an hypoglycemic attack. Okay, The other acute complications are diabetic ketoacidosis, hyperosmolar hyperglycemic non-ketotic coma. There are chronic complications also which happen in the eyes, the kidneys. So we will discuss them as we go on. I have to touch base with metabolic syndrome. Metabolic syndrome is generally seen in adolescents and younger adults. What happens over here is there is obesity plus cardiovascular changes and an insulin resistance. Okay, so patient will be obese, will have some cardiac problems also, and there will be diabetes also. There can be vascular or chronic complications. It's a part of diabetes, chronic complications also. Now we're discussing the acute complications of DKA, that is diabetic ketoacidosis. There is a lack of glucose in the cells which leads to a catabolism of fats and proteins, which leads to fatty acids and then metabolite formation known as ketones or ketoacids in the blood, which causes ketoacidosis. What is the cause? Either an infection or stress, there is either an error in the dosage, or there is an overindulgence in food or alcohol. Everything can affect the glucose and the insulin, that is the relation between glucose and insulin that was scheduled can be disturbed. Okay, what are the signs and symptoms? Signs of dehydration will appear. There will be thirst, dry rough oral mucosa, warm dry skin, rapid pulse, weak and thready pulse you will see. There will be oliguria and decreased urination, and it will be sweet smelling, so ketonuria. There will be Cosmos respiration. So what do I mean by Cosmos respiration is acetone breath. So acetone breath is a sweet smelling breath. Everything about DK is sweet. Okay, the breath that the patient is taking is sweet smelling. The urine that you will get will be smelling like fruits or something. That is also helping to diagnose. There can be lethargy and decreased responsiveness in the patient. Why? Because there is less glucose, which is affecting the central nervous system, causing it to go into depression. There can be metabolic acidosis. There is an imbalance of sodium, potassium and chloride, and the signs can be abdominal cramps, nausea and vomiting. Generally DKA is seen in type 1. Okay, generally type 1 patients are having DKA complication. What is the treatment? I know, despite of having hypoglycemia, the treatment is you give insulin and bicarbonates, and you also give fluid and electrolytes to keep up the hydration. Okay, next acute complication was hyperosmolar hyperglycemic non-ketotic coma. So that is the counterpart of DKA, and this complication is seen in type 2. There is a relative insulin deficiency which is leading to hyperglycemia, and there is a dehydration development. The patient will have, the affected individual will have neurological deficits, muscle weakness, speech difficulties and abnormal reflexes because of the excessive glucose. Okay, so there is actually insulin is going on, but it has become deficient. So because of that the glucose levels have increased, but the patient has developed dehydration because of loss of the fluids from the body. That can lead to because of the loss of fluid can lead to hyperosmolar, right? Increased ions in the serum, so hyperosmolar, glucose levels are increased. No, here lipid is not getting broken down. Okay, so non-ketotic, and coma because excessive glucose is affecting the CNS, and that is causing neurological deficits. Coming to the chronic complications, there is degenerative changes in the tissues due to excess glucose or insulin deficit. Okay, there will be, because you understand glucose, it's going to be excessive for a longer time, so all the organs will start showing changes, a little bit of degenerative changes. So if the vessels, the vascular changes will be microangiopathy, where the capillary basement membrane can become thick and hard. It causes obstruction, rupture of capillaries, tissue necrosis and loss of function.